We are moving on to the next topic, which is talking about the sternal angle and the mediastinum. What is mediastinum? Mediastinum is actually the middle septum. Middle septum means, where is the middle septum? Which is separating the right lung and the left lung. So between right lung and left lung, you have some median septum, mediastinum. Yes. And in that mediastinum, you will keep the heart and the blood vessels. So heart and blood vessels in the middle septum, mediastinum. Yes. What else there in the mediastinum? There are a lot of things, but this is just the idea that between right lung and left lung, you have a middle septum, and in that is called mediastinum, where you keep the heart. What else do I keep there? Let us see. This question is asking arch of aorta beginning, and you say arch aorta beginning or ending is same level. And what is that same level given in Gray's anatomy? Gray's anatomy says arch of aorta beginning, ending is same, and it is T4 vertebra. Now, if you say T4 vertebra is the answer, fine, I'll remember that, but show me the diagram. And to discuss the diagram, you have this diagram now. You are putting a disc between T4-5 vertebra. You look at the disc between T4-5 vertebra, put a straight line anterior to touch the bone sternum at the manubriosternal junction. Second rib will attach here. In fact, second costal cartilage will attach here, and this is called as sternal plane. So where do you put the sternal plane? It is disc between T4-5 vertebra and touching the sternum at manubriosternal junction, which is also attachment of second rib or costal cartilage number 2. If you say that is a sternal plane, fine. I think the sternal plane is separating the superior mediastinum from inferior mediastinum. Yes, that's correct. It is separating superior mediastinum from inferior mediastinum. And then you will see inferior mediastinum itself has 3 divisions. Tell me about the inferior mediastinum 3 division. Actually, that is where you will tell the heart and the ascending aorta. The heart and the ascending aorta are in the middle mediastinum, part of the inferior mediastinum. So you are telling the heart and the ascending aorta are content of the middle mediastinum itself is a component of the inferior mediastinum. Yes. What is the space in front of the heart then? The space which is in front of the heart is then called as anterior mediastinum. So that is anterior mediastinum. Yes. And what is that space which is behind the heart? That space which is behind the heart is, of course, posterior mediastinum, and it is longer than the anterior mediastinum because it is reaching till the T12 vertebral level. It is reaching till the T12 vertebral level, and it is quite long. What is inside that? Inside that, let us find out. But do you know where the ascending aorta is? Yeah, I know ascending aorta is in the middle mediastinum with the heart itself. Yes, ascending aorta is in the middle mediastinum along with the heart. Where is the arch of aorta? Arch of aorta. I think arch of aorta is in the superior mediastinum. Yes, behind the manubrium bone. Behind the manubrium bone. So arch of aorta is behind the manubrium part of the sternum in the superior mediastinum. Where is the descending thoracic aorta? Descending thoracic aorta is going behind the heart, so it is in the posterior mediastinum. And along with the descending thoracic aorta, what do you got? The esophagus. This esophagus is not only present in the posterior mediastinum, it was already present in the superior mediastinum. And when you say the esophagus was in superior mediastinum, it is sandwiched between. There the esophagus was sandwiched between trachea anterior and vertebra posterior. Trachea anterior and vertebra posterior. Sandwiched between the two is esophagus in the superior mediastinum. And what about this other mediastinum? Where is the esophagus passing? Superior mediastinum and posterior mediastinum. One examiner is asking, do you have esophagus in the anterior mediastinum? You say no. There is no esophagus in the anterior mediastinum. Esophagus is actually in the superior mediastinum and also posterior mediastinum. That you remember. Now we are going to draw the diagram. As you are going to draw this diagram, first you have to tell that this is the vertebral level. Which vertebral level? You have remembered that it was the disc between T4-5 vertebra. So disc between T4-5 vertebra. Okay. What about that disc between T4-5 vertebra? The intervertebral disc between T4-5 vertebra, you put a straight line anterior to touch the bone sternum anterior. As you are touching the bone sternum anterior, you'll find it is actually having a manubrium part of the sternum, and this is the body of sternum. You mean to say manubriosternal junction here, where you have attachment of costal cartilage number 2 there? Yes, that is called sternal plane. This is the sternal plane. So where do I put the sternal plane? You have to put the sternal plane at the disc between T4-5 vertebra. So intervertebral disc between T4-5 vertebra, that is where I put the sternal plane. Yes, and the sternal plane is going to touch the bone sternum at the manubriosternal junction. And what is attaching to manubriosternal junction? Costal cartilage number 2. And what is this bone? This is the manubrium part of the sternum. And that bone, there is a body of the sternum. Remember, this sternal plane is dividing the mediastinum into 2 parts. What are the 2 parts? There will be a superior mediastinum and there will be inferior mediastinum. So this sternal plane is dividing the mediastinum into superior mediastinum, inferior mediastinum. Yes, who is in the superior mediastinum then? If you want to know that, then I'll tell you it is the trachea. If you say trachea is in the superior mediastinum, then where is it bifurcating into bronchus? It is bifurcating into bronchus here at the sternal plane. So you're telling that trachea is in the superior mediastinum. Yes. And then it is bifurcating into bronchus at the same plane, sternal plane there. Yes. Are you trying to say tracheal bifurcation is at the disc between T4-5? Yes. And what if the disc between T4-5 is not given? Then you can answer it as the upper border of the T5 vertebra. And what if the upper border of T5 vertebra is not given? Then you have to answer it as the upper border of the T6 vertebra. And what if that is not given? That is also not given. Yeah, then what do? Then I'll say lower border of the T4 vertebra, that patient is already dead and it is a cadaver. Oh, it is a cadaver now? Yes, understand. Somebody asking you, where is tracheal bifurcation? The best answer is disc between T4-5. If not found in the option, change your answer to upper border T5. If that is not found, change your answer to upper border T6, especially this will happen in deep inspiration, which we generally do when we take the chest X-ray. So you are telling that trachea will be at the upper border of T6 if we have taken deep inspiration while taking chest X-ray. Maybe to keep enough air in the lung. And what if somebody asks me where is tracheal bifurcation cadaver? Then you say T4 vertebra. Lower border of T4? Yeah, maybe. Right. Then what about the angle which is between the manubrium bone and the body of sternum? Actually, there is a sternal angle of Louis. How much? This is sternal angle of Louis, and it is the angle between manubrium sternum and the body of sternum. Yeah, what is this angle? How much is that? This sternal angle of Louis is 163 degree. 163 degree. So it is angle between manubrium bone and body of sternum. Yes. And it is 163 degree. Yes. And it is the sternal angle of the Louis. Yes. That is where the trachea was bifurcating into 2 bronchus. Yes, that is correct. That is the landmark. And what about the aorta? If you want to discuss aorta, then I'll tell you the heart is in the inferior mediastinum. Yes, of course, it is in the inferior mediastinum, but which part of inferior mediastinum? It is in the middle mediastinum. Now, if you say the heart was in the inferior mediastinum, middle mediastinum, what about the aorta? If you want to talk about aorta, then this is the aorta, ascending aorta, and then I have got arch of aorta, and then I have got the descending aorta. So, descending thoracic aorta? Yes, that's the point. Is ascending aorta? Yes. That is ascending aorta. So you're telling that the heart is in the inferior mediastinum. Yes. Actually, the heart and ascending aorta both are in the inferior mediastinum, and with the exactly in the middle mediastinum. And where is the arch of aorta? Arch of aorta and the trachea both are in the superior mediastinum, above the sternal plane. So arch of aorta and the trachea are both in the superior mediastinum, above the sternal plane. Yes. Where is the descending thoracic aorta? Descending thoracic aorta is obviously in the inferior mediastinum, but in the inferior mediastinum also it is exactly in the posterior mediastinum. Posterior mediastinum. So descending thoracic aorta, inferior mediastinum, in that also in the posterior mediastinum, along with the esophagus. Yes, along with the esophagus. Esophagus was actually present in the superior mediastinum, then continue in the inferior mediastinum also with descending thoracic aorta. Now one question is asking where the arch of aorta beginning. You say arch of aorta beginning or ending is same level. Yeah, what is that level? That is the sternal plane. What is sternal plane? They are asking which vertebra. Oh, arch of aorta starting, beginning, ending, which vertebra? Then I'll say T4 vertebra according to Gray's anatomy. Arch of aorta beginning, ending is T4 vertebra according to Gray's anatomy. Okay, now they're asking where is the arch of aorta beginning? Arch of aorta beginning means now what they are asking? Which costal cartilage? Oh, costal cartilage. Then I'll tell. Arch of aorta beginning at costal cartilage number 2. Costal cartilage number 2. So these are some of the questions they're asking, and you can tell arch of aorta is in the superior mediastinum behind the bone manubrium, and beginning ending is same, which is T4 vertebra, and it is also the same costal cartilage number 2 where it is beginning. Now with all that information you got here, this is a CT scan at which level? At the T5 vertebra level. So this came as a question. You have to identify the structures. T5 means already trachea would have bifurcated. Yes, you see here carina. What is carina? Carina is the cartilage at the bifurcation of the trachea, remember? Oh, this carina. Yes. You mean to say now you are going to have left principal bronchus there? This is inferior view. Yes, inferior view. The CT scan, MRI are seen from inferior view, usually. So that is left principal bronchus. This must be the right principal bronchus then? Yes, that will be right principal bronchus. So now we are telling that this is which vertebra? It is a transverse section at T5 vertebra. And that is where you see this carina or the bifurcation of the trachea into two bronchus. One is the left principal bronchus. Yes, it is left principal bronchus. And then you have also shown the right principal bronchus there. Yes. What else you see? What I see is that there is this ascending aorta, which is anterior, and then there is the descending aorta, which is posterior, where it is here. So you are telling some arch of aorta will be there. Yeah, actually understand. There is ascending aorta, which is anterior, and there is descending aorta, which is posterior. Then what else is there? You will find that there is this question. What is the question? It is asking CT scan at T5 level. The same level? Yes, CT scan. CT scan at T5 level. So where is ascending aorta? So that kind of questions are coming. You already have found actually that ascending aorta is here anteriorly and descending aorta is there posteriorly. One more vessel you have to focus upon, and that vessel is pulmonary trunk, dividing into the right and left pulmonary artery. So remember that pulmonary trunk dividing into right and left pulmonary artery is also happening at the same level, where you have arch of aorta beginning ending, where you have the tracheal bifurcation, that is where you have the pulmonary artery giving two branches also. They are almost the same level. You mean to the T5 level? No, not T5 exactly, it is the disc between T4-5. But if the disc is not given T4-5, then you can say T5, no problem. You find this is one question asking tracheal bifurcation. What do you think is the answer? If somebody asks me tracheal bifurcation, then I will say it is yes. This could be in T for phi. Yeah, but it is not given. Then I'll say T phi. Yes, the upper border of T phi. And what if it is missing in this question? If it is missing, then obviously then I'll take my answer as T4, which is also the answer in cadaver. So in cadaver, it is C4. Yes. But is this a question on cadaver? No. Then what is your answer? My answer should remain T phi. So in this question, the answer should remain T phi. That is how you practice more and more MCQs. Then you realize that what is the importance of discussing different type of scenarios, because scenario can change and your answer will change accordingly. You cannot learn that without practicing MCQs. So this is the answer here presently. Yes, it is. What is this? This is the front view of the individual showing the costal cartilage number 2. And why? Because that is where the arch of aorta beginning ending. If you say that is where the arch of aorta beginning ending, then where is it beginning? Right side, left side? Actually, arch of aorta is coming from right to left side. So starting costal cartilage number 2 on the right side, yes, and going to the same level on the left side. Yeah, actually, arch of aorta beginning ending is same level, so it is beginning on the right side, costal cartilage number 2, and then going towards the left side, costal cartilage number 2. And this is also the sternal plane. If you say this is the sternal plane, then I think it is going to separate the superior mediastinum from the inferior mediastinum. Yes, that's what it will do. This is the sternal plane which is dividing superior and inferior mediastinum, and you already know the arch of aorta will be in the superior mediastinum. When you say arch of aorta is in the superior mediastinum, I think the trachea is also in the superior mediastinum. Yes, trachea is also in the superior mediastinum. Then I think the heart is in the inferior mediastinum. Yes, the heart is in the inferior mediastinum. Along with the ascending aorta, it is in the middle mediastinum, part of the inferior mediastinum.